like to begin with when hospice began in the United States, which was actually in 1974. And in 1986, Medicare made hospice part of their permanent benefit. And we fast forward to 2012, and we have literally more than 5,500 hospices in the United States, and 1.6 million folks have received care in hospice. And of that, 83% of those individuals were 65 years of age or older. So pretty amazing. 1974, one hospice. Not so many years later, we're really reaching out at end of life, and a lot of people really are embracing hospice at end of life. So what is hospice? Our goal in hospice is that it's to provide compassionate care for people facing a life-limiting illness or injury. When you choose hospice, you go from a curative care to a palliative care. We're here to provide comfort, we're here to manage your symptoms, and both spiritually, emotional, and pain at end of life. And our core belief that each of us has the right to die pain-free with dignity and passion to ensure a natural death occurs, and that our goal is that we do not hasten death in hospice. So some of the questions that we receive is, how do I initiate hospice? Anybody in here could call a hospice agency and say, I'd like to have information regarding hospice. You don't need a physician to receive information. However, if you really are looking at choosing hospice, you really do want to have that conversation with your physician, because when you do elect the hospice benefit, two physicians must certify that you have a life-limiting illness, and that if your disease takes its normal course, you will have less than 6 months to live. So very important. You just can't arbitrarily decide to roll in hospice. There's very specific requirements around it. The other interesting thing in hospice is that they are looking at multiple diagnoses that create your end-of-life prognosis. And that's important to know when we talk about what is available under the hospice benefit. The other, I think, wonderful aspects of hospice is that it really is a team approach. Not only does hospice take care of the patient, but they really take care of the family. And in some instances, it's the family that receives more care at end of life than the patient, depending on when your family member chose to elect hospice. From spiritual care to pastoral care to nurses, doctors are all there to make sure that we hold your hand and walk you through that journey at end of life. The core services that are under the hospice benefit are our medical director, our nurse practitioner, nursing, aides, pastoral care, spiritual care, volunteer services, medications, supplies, PT. Some people think when you elect hospice, oh, I can't have physical therapy anymore, I can't have occupational therapy. That's not true. There are many times that we will bring into the home a therapist because you may need it. You may need it because you're a fall risk. We don't want you to fall. We don't want you to hurt yourself. We want you to be safe. So you may need a little bit of physical therapy or occupational therapy. Or maybe for food and nutrition, you're not swallowing as well as you should. So we're going to bring in a speech therapist to try to help you to be able to take food. Remember, our goal is quality of life and to enjoy your life as much as possible until the very end. Also provided under our hospice core services are bereavement and grief services, which are so important under the hospice benefit. Also, durable medical equipment. Hospice expects people to provide the care in the home. How can you provide care in the home when you may need equipment to do so? People who are at an end of life may not be able to receive services in their bed. They need a hospital bed. So hospice will provide all that for you. Volunteer services are instrumental. Medicare actually mandates that 5% of all of our care provided is done through volunteers. And why are volunteers so important? Because they're the folks that come and can sit in your house and give you a break. We have pastoral care volunteers, and we have volunteers that are that help with your spiritual needs, your emotional needs, and then we also have volunteers that are there just for giving you, the caregiver, a break. So I talked about the hospice team members. The other wonderful aspect of hospice, again, is that weekly we come together, and all those team members that I just discussed, the physician, the nurse practitioner, the social worker, the pastoral care, spiritual counselors, the bereavement counselors, all come together once a week, and we discuss the family and the patient. How are you doing? What's going on? What's happening with this family? What do we need? Where do we need to add extra support? We always say in hospice that when you're in the middle of anticipating a loss, all the losses that you had before start to come up because they just bring back memories and you can't help it. So we really, again, want to walk through that journey with you to make sure that you are whole spiritually, emotionally, and physically with the patient. There are different levels of hospice care, and when I talk about hospice, we always talk about home hospice. And that is because there is an interesting Medicare rule. Medicare has a rule that's called the 80-20 rule, and 80% of all hospice care needs to be provided in the home. And so it's very important for you as potential caregivers that we support you to be able to provide that care in the home. And home is your home, your family member's home. It could be an assisted living, it could be long-term care. It's wherever the person currently calls home to provide hospice care. And again, with the bereavement counselors and the therapists, again, we always invite the family and, when possible, the patient to come to team. You as family members provide an invaluable amount of information on how we provide end-of-life care. You are sometimes the person who is telling us, what is that patient's beliefs? What are their rituals? What are their spiritual needs? What is it that kept that person going throughout their life? And our goal is to keep that person going until end of life. How is hospice covered? Hospice is, since we referenced that 83% of all hospice care is provided to folks aged 65 years of age and older, obviously Medicare is our primary coverage in hospice. However, Medicaid, managed Medicare, and commercial insurances also cover hospice because we do have folks that are younger than 65, unfortunately, in hospice. And we do lose people in their 20s and 30s and 40s all the time, which again is another level of care that we need to look at when we're dealing with younger folks. And the other interesting part is charity care. And I always like to talk about our fund at Stella. We have a Monsignor Linus fund. And that began in the early 80s. Monsignor Linus was the first individual who died in our inpatient hospice fund. And so what we do is we raise money every year because there are many folks, and end of life can be very expensive. If you are a younger person and if all hospice is provided at home and the person that has a life-limiting illness was the main breadwinner of the family, you now are taking care of that person, you were working, you can't work anymore, well, what do we do? Hospices never turn anybody away, whether you're uninsured or underinsured. We always, through our charitable benefit, are always going to reach out to you and provide your needs. And we have covered utility bills, we have paid for rent, we have paid for cremations, we have paid for mortgages, we have brought food into the home. We have paid to help you at end of life because it is truly our passion to do so. The other parts of this I always like to bring up before we go into the spirituality end of it is, can I change my mind? Absolutely. There's no person in here that's going to say, oh, you must have hospice. You signed up, you elected hospice. Forget it, you can't disenroll. No. We have had people that change their mind all the time. That's fine. That's your decision. We're not here to convince you to stay in hospice. We're here to support you when you make that decision to elect hospice and choose end-of-life care. That's our right to help you. We want to help you through that. And we have had people that change their mind. I feel better. I want to try again. I'm not ready for end-of-life care, and that's perfectly fine. So spirituality at end-of-life is huge. It brings up end-of-life in hospice, we always say. It either brings people together or tears them apart, and there really is sometimes no in-between. And lots of time that is spiritual unrest. How did I live my life? What were my life choices? What is my relationship with God? Where do I gather my comfort, my dignity, or my hope at end of life? How do I kind of get all that? You know, did I do things in my life that I wasn't really happy about? It does cause a lot of unrest, and that's where our spiritual folks really come into play, finding out what your faiths are, what your faith, what your tradition, how do we walk you through this at end of life? What are your personal beliefs? What do you want? How do we honor your personal beliefs? And I think in that, when you look at your healthcare decision-making under Catholic Declaration, is really choosing that person. And when you choose your healthcare decision-making through the Catholic Declaration, you're choosing what you want at end of life. It helps us to honor, because whatever you do, always choose the person who's going to speak for you and speak for you the way you want to have be handled at end of life. It's really very, very important. The other part to this is, you know, sometimes in hospice we will see a person that's struggling, the patient, and by all means this person is probably hanging on for some reason. What is the unrest in their life? And we are very quick at that point to bring in pastoral care. What is preventing this person? Because by all means of physically assessing this person, they are ready to pass on, but something's not allowing them. And we talk to the families. People's hearing is the last to go. I forgive you is powerful. I love you is powerful at end of life. And it really does. We've seen it time and time again where something is going on that we're not sure about, and those words are whispered, and literally hours to minutes later that person is at rest and can go. So think about that. We always think about that at end of life. We also have a prayer shawl ministry that is really beautiful. Our prayer shawl ministry is done by our I say ladies because ladies knit, whatever. We don't think we have any men in this group, but they do our prayer shawls. They say a prayer, and that prayer shawl is given to every patient who wants a prayer shawl, and that it's very symbolic. And there's a prayer that's said over the patient when the prayer shawl is given. And regardless of your faith, those prayer shawls are valued deeply by our patients and our families. It really is just a source of comfort. So we talk about a good death, and a good death for us in hospice is a person who is pain-free. We've met their emotional needs, we've met their spiritual needs, and we've prepared the patient and the family really for where they need to be at end of life. Are your heart and your head together? Not always. Lots of times your heart or your head knows what's happening, but your heart is not there. And it does take a little bit of time to really kind of pull those two together. And education, education, education is what we're all about. I'm going to end real quickly with some myths that we always do continue to, I think, talk to people about. And the first myth is that hospice will starve me and stop all my medications. No, not at all. And in fact, if you refer to questions and answers under page 4 and 5, we really mirror the declaration of the Catholic teaching on nutrition and hydration. Just in hospice, people certainly have tube feedings. To us, it's your meal. You know, we're all about life, believe it or not. In hospice, we're all about living a quality of life till your end of life. And so we're not going to arbitrarily stop a tube feeding or hydration. The person's body will tell us when hydration and tube feeding are not working any longer. Your body is very good at telling us that. And so we very carefully then begin to adjust and decrease amounts of food and nutrition, because at some point when your body is at end of life, your body slows down and your body doesn't need nutrition any longer. And in fact, at end of life, truly at end of life, nutrition is going to be more harmful than it will be good. So it is something that is a case-by-case basis. We always look at it, and it's nothing that is ever arbitrarily done. Pain medication. Again, hospice care manages pain using addictive narcotics. Yes, we do use narcotics, but again, we are not here to hasten death. We are here to free suffering. And again, referring to page 5 under the Catholic teachings about what the Church teaches about pain and suffering, we're giving doses of pain medicine to manage a patient's pain. We are not here to give you pain medication to end your life. We're here to stop your suffering. And yes, there will be times when the pain medication needs to be given and needs to be increased on a regular basis, and you are going to have side effects of being sleepy or maybe even not alert any longer. But remember, your hearing never goes, and so you can always still communicate to your family member. And just in closing, I just want to talk about the end of the bereavement end of it. Anyone who is in hospice, who has a family member that passes away in hospice for a year after hospice, anyone in the family is given grief and bereavement care, and that is your right to choose or not choose it. We hope that you choose it because we believe that it's very valuable. And things that we hear at End of Life after you lose somebody is, how do I go on living without this person? I lost my dinner partner, I lost my my soulmate, I lost the person who balanced my checkbook. You know, I lost very practical things. And so, you know, grief and loss counseling really do help you through that. And it's just, I like to close with just a real quick little brief poem on grief. Grief is not a disorder, a disease, or a sign of weakness. It is an emotional, physical, and spiritual necessity. The price you pay for love, the only cure for grief is to grieve. Thank you.